Hello, I'm Dr. Herman, and thank you for welcoming us into your home to share another wonderful, life-saving, life-changing, life-transforming story with a wonderful patient in my practice here. We're in South Florida, and right next to me, this is Christine, and Christine lives about 30 minutes north of our office in Boca Raton, Florida, and Christine started receiving information from me on the internet probably over a year. It's at least a year ago you started receiving my information, right?
Yeah, about a year ago.
Yeah. And it took you several months of reading my information and watching my videos before you finally came in. And Christine has Hashimoto's thyroiditis. And Christine, if we can talk about some of the symptoms that you had when you first came in. What was it like for you before you came in here and when you first came in? I mean, what were the symptoms that you wanted to rid?
Memory loss, exhaustion, dizziness, nausea, joint pain, insomnia.
Digestive problems?
Digestive problems,
That
a lot of
seems big.
bloating, a lot of
bloating.
stomach pain.
Okay. And what kind of doctors were you going to, and what therapies, what nutrients, what did you do before you came here that made you finally say, I have to do something else?
Well, I visited every specialist, endocrinologist, gynecologist, rheumatologist, and was told that I had a thyroid issue. They wanted to put me on meds. They told me I'd be on Synthroid for the rest of my life, and that there was nothing that they can do for me.
Nothing else?
No.
And did you ever take any of the thyroid hormone replacement?
I did.
Which one did you take?
I took Synthroid for a month or two and got very sick, and then I went to a more natural, it's called the Armor Thyroid.
Armor.
And I was on that for about two to 3 months, and then I realized I wasn't feeling any better.
Okay.
And then shortly thereafter, I came in here.
Okay, so Synthroid actually made you sicker. Wow.
And the Armor.
And Hormone made no difference, so it had no
No.
benefit. And we saw, excuse me, and we saw in your last blood test, actually 2 blood tests ago, you were concerned that as we were getting through steps in this program here, her whole body integrative drug-free thyroid recovery program that I offer here, you were feeling better, but the blood test came back that you had your medical doctor, who you still see for whatever reason, he ran a blood test and you saw that the thyroid still looked off normal function. Remember that TSH was still up and your symptoms were better, or your functions were better, you felt better, but TSH was up and your T3 or T4 was low. And he was considering putting you on thyroid hormone replacement, which you already tried, that didn't work. But we also saw on her blood test that she had a little bit, not terribly low, but she was a little low in iron. And when we understand, which I point out in some other videos, the iron, a slight iron deficiency won't allow her body, her thyroid or your thyroid, to make enough T4. And if you can't make enough T4, you can't make enough T3. It's humanly, physiologically impossible. And once we put you on a little bit of iron support, natural iron support, what happened then? You had the next blood test? And what happened?
My numbers were perfect.
Numbers were perfect. Without taking a thyroid hormone replacement medication, it came up. And we're still, Christine had on the first day when I examined you, we found a tooth in your mouth that was really bad. Right, and that was one of the main things that had to be handled for her, because there were some, if I may say, there were some infections that we found.
There was an infected root canal.
There was infected root canal.
Yeah, and an infected crown.
An infected crown.
Yeah, at the bottom of the tooth.
Mm-hmm.
That was probably there, that I knew of for about 3 to 4 years.
And just
but no symptoms.
No symptoms in the mouth.
No symptoms in the mouth.
Right, but symptoms in the body. Right. And I was able to trace that the teeth were related to her thyroid and other intestinal issues and neurological brain fog and so on. And she had to actually have one of the teeth removed. Unfortunately, it's removed, but fortunately, the disease is no longer in the mouth. And right away, you felt just a miraculous... Immediate change.
Much better.
Awesome. And she's pretty happy. So Right now we're going on one more round of some parasite cleansing in her body, and part of the little bit of brain fog that's left, which the majority, how much better is your brain fog? I mean, how much lifted is it?
I'd say about 80%.
80% better. So there's
80%.
still 20% that has to come up. So we're still dealing with a little more gut inflammation with parasites that we're cleansing right now. Once that's done, I expect that brain, if it doesn't need a little more tweaking of some brain food, and we can get more into detail on a visit with you, but with her brain to need a little more nutrient to be able to pick that up. But your pH is doing good. You're doing good overall. Yeah. Mm-hmm. Is there any reason why people who watch this should come? Yes.
Well, you'll learn a lot about your body and about your health and what the underlying causes are. And I also wanted to touch on and make everybody aware of how dangerous and toxic mercury is in the mouth. And I know I have family and friends that still have mercury in the mouth, and if it's not removed properly, that's another issue, how it leaches into the body and into the thyroid and into the brain. And so I am beginning that detox also to detox the heavy metals in the body.
Yes, that's true.
Which were very high.
Yes.
And so I'm mercury free in the mouth and infection free, and I feel 85% better.
85. And how long have we been working together?
7 months.
7 months?
7 months.
And right away, I mean, it was probably around like month 1 or 2 once we figured out what the priority was to get rid of the toxic or infected effect on our body. I mean, you already felt a dramatic improvement pretty soon.
I could barely walk in the door.
And now you're running.
Now I'm full of energy.
Awesome.
Back to work full time. I was out of work for a couple of months, unable to work.
And now you're ready to tackle a new business, you're telling me. So it's awesome.
Yeah.
All right. So thank you for sharing with everybody.
Thank you.
And
Good
you're
luck
welcome.
to everyone. Come in and see him.
Yeah, thank you. And again, it's a unique philosophy. It's a unique way of going about the body. And I welcome you to come in here and get results like Christine did. And again, without thyroid hormone replacement, she is significantly improved in her daily functions. And so you can call us at 954-370-3100 and watch my video online, Hope for Your Thyroid. You can recover your thyroid naturally. And thank you again for letting us come into your home or workplace and share the story with you.